Stand by SOT1.
Standing.
10 seconds. Ready, rollin'. Ready, SOT1.
Ready.
In 4, 3, 2, 1. Roll in.
From legendary Uncle Studios in beautiful Southern California, welcome to another edition of Work Comp Matters, the central location for you employees, you employers, and of course, we haven't forgotten about you damn independent contractors. And now, here's this week's edition of Work Comp Matters. And it is July 15th, a tax day, 12 noon, and welcome to another edition of Work Comp Matters. We are brought to you by the workcompcentral.com. If you want the number one location for workers' compensation in both California and around the United States, check out the workcompcentral.com. They've got a free 7-day offer. And if you want to pick up their services, I have them. You should too, damn it. It's only $1 a day. Work Comp Matters is also brought to you by A1 Law, the number one computer management system for workers' compensation attorneys in California. 818-357-4120 for your no strings attached. Money back guaranteed, also $1 a day. A1 Law. Well, good afternoon, everybody. My name's Steve Appell. I'm joined by the madman across the water, Mr. John Scalia, as well as my chief of staff, the doctor, but he's not a medical doctor, Mike Zyma. Recommendations approved by the Orange County Board of Education to welcome students back to campuses without increased social distancing in classrooms or the mandatory use of masks were met with a fierce backlash from educators and parents yesterday. And some school officials are already saying they don't intend to go along. It's reckless, and it's causing undue fear among teachers, students, and parents alike. Ocean View School District Board President Gina Clayton Tarvin said of the board's action, 7 members of Congress penned a letter to the board Tuesday in response to its recommendations, saying they were deeply concerned. Meanwhile, county health officials reported 865 new coronavirus infections yesterday and 9 more fatalities, bringing the death toll to 433. I want to go to the madman across the water, Mr. John Scalia. We've been speaking more and more on Work Comp Matters lately about the reopening of schools in beautiful Southern California. And it's becoming clear to me that regardless of whether or not Orange County, San Diego County, Los Angeles County, Ventura County, wherever, are going to reopen, you can't force kids to responsibly wear masks in school. I understand the administrators must wear masks. I understand the teachers must wear masks. I also understand that the threat of medical coronavirus infection is considerably more to the adults than the teachers. But John, can we and should we really force students K through 12 to wear masks? Your take.
Yes. I mean, were you an uncontrollable child or what? I mean, seems to me.
John, I'm an uncontrollable adult. Forget about me as a child, but go ahead.
Well, I mean, we're all uncontrollable as adults because that's one of the prerogatives you get of becoming an adult. You get all the obligations, but you get to be more or less uncontrollable. But as a child, you should be able to, you have to follow the orders of your superiors, which are your teachers and your parents. And yeah, I think they should be allowed to dictate that they wear masks. And if they don't, kick them out.
And
But
John,
of course,
and sorry, I'm sorry to interrupt, but
yeah.
do you really think that the officials in K through 12 are going to be able to control the students at breaks, at lunch, at recess to wear masks? I mean, I really want to know.
Well, I think that's a problem in the society at large. I think, and I may sound like an arch conservative, but I think one of the biggest problems with education in America, public education, is the fact that there is no control by the teachers. There's no discipline. There's no discipline among the students. The teachers don't have the right to enforce it. And that's a systemic, culture-wide problem in America. But if you're asking me theoretically, should they be able to do it? The answer is yes. I mean, obviously I went to a prep school in San Francisco, and I went to a Catholic elementary school. And if we'd been told to do that, we all would have done it. And there would have been no question. And we would have been kicked out if we didn't do it. And you would have gotten more grief at home. The parent wouldn't go to the school and say, "What are you doing?" You'd get more grief at home for having not complied with the rule than the ridiculous idea that the parent goes to the teacher and says, "What are you doing to my kid?" I mean, the perfect example of that is my daughter wasn't getting the material in second grade, right? Due to my divorce, they were in public schools. And so they came to me and they said, your daughter, we don't think she's getting it. We'd like to keep her back. And I looked at them and I said, let me ask you, I said, why are you asking me? You're the teacher. You're telling me she's not getting it. Why are you asking me if you're going to hold her back? And they said, well, we're required to. That's asinine. Okay. I said, no one's going to care if she's a year older when she's in college. Well, somehow it didn't stop her from getting into West Point. So it was the right decision. But it's ridiculous that has to happen. And that's all politics. The public education system in America has become overrun by politics and not by education.
Dr. Mike, my mom and dad went to public school at LA Unified. I went to public school at LA Unified. My children went to school at LA Unified. You of course, are just north in Santa Clarita School District, Saugus School District, whatever it is. You've also got a grandchild in the oven waiting to burst out. Do you think that we can force K through 12 to not only wear masks in class, but also at recess, lunch, break times? What's your take? PE for that matter, PE, go ahead.
This is life or death. This is not effing around. Absolutely. And if they're not wearing their mask, they get sent home. But again, I mean, at least as I understand the science, they're not necessarily concerned that the kids are going to get the virus. They're more concerned that they're going to bring it home to their parents and their grandparents. That's why I'm going to be very interested to see what my school district in Santa Clarita, William S. Hart School District, to see what they do. I have a feeling it's going to be a mixture of virtual classes and in-person classes. The board meets tonight on these issues.
And
Can I chip in?
Yeah, and I think this is a fascinating story that's developing right before our eyes. Los Angeles, the school district. Hang on just a second, John. Okay. Los Angeles School District, Orange County School District, Ventura County School District, San Diego County School District. There is no uniformity above the around with those four school districts. This is going to be a fantastic developing story. Go ahead, John.
Yeah, I saw an interesting piece, believe it, since I don't get BBC, I watch CNN a little now. And I saw an interesting piece from a pediatrician at the University of Washington Med School. And he was advocating that schools open up in person. And the reason was that, online learning, there's evidence that kids don't learn as much online, and they learn a lot more in person. But his point was, if you're going to do that, he said, yes, you should do that. He said, but here's what you need to do. He said, you need to give the school districts money so that they can equip their teachers just like frontline workers in hospitals. They should get PPE gear. They should be insulated from the virus, more or less. So, and I think that's a good idea, but that costs money. And as you know, there's nobody, the administration of America is perfectly willing to give American Airlines a subsidy, but they're not going to send money to school districts to get the kids back to school. They're just going to threaten them.
Yeah, I can just imagine a kindergarten teacher wearing a hazmat suit. Mike, you've got the next news story. Go for it.
All right. Now, with coronavirus cases surging and the need for testing at an all-time high, California officials are putting pressure on major health insurance companies to help finance the fight against the pandemic. The State Department of Managed Healthcare will soon issue new regulations requiring health insurers to pay for coronavirus testing for most patients, state officials said Tuesday. They hope the move will lead to large hospitals, clinics, and other healthcare providers conducting more testing at a time the public needs it the most.
And I thank you very much for that. More than 2,000 inmates at San Quentin have tested positive for the coronavirus, and 10 have died, with at least 3 more deaths reported since Saturday. 2 inmates who had been hospitalized outside the prison died Saturday. The California Department of Corrections and Rehabilitation said in a statement Monday, bringing San Quentin's COVID-19 death total to 9 at that point. An additional death added to the CDCR's online tracker yesterday morning brought the prison's death toll to 10. My name's Steve Appell. You're dialed into Work Comp Matters. We're brought to you by workcompcentral.com. If you want the #1 location for workers' compensation in both California and around the United States, check out workcompcentral.com. They've got a free 7-day offer. And if you want to pick up their services, it's only $1 a day. Work Comp Matters is also brought to you by A1 Law. #1 computer management system, 818-357-4120 for your no strings attached money back guarantee. Also $1 a day. A1 Law, well, he practiced California workers' compensation for 35 years, and now he's hanging out in Munich, Germany. He's got a story. He's got a rant. And obviously, as you can tell already, he constantly disagrees with me about the COVID-19 coronavirus. Mr. John Scalia.
Hi. This story is about the CDC being end-arounded by the Trump administration. It's from AOL. Hospitals told to send coronavirus data to Washington, not CDC. The Centers for Disease Control and Prevention will, quote, no longer control, close quote, the coronavirus data collection system from hospitals across the nation, a spokesman for U.S. Health and Human Services confirmed Tuesday night. The New York Times reported earlier Tuesday that the administration had ordered hospitals to bypass the CDC and send all COVID-19 patient information to a central database in Washington beginning Wednesday, raising concerns from health experts that it will be politicized or withheld from the public. Michael Caputo, Assistant Secretary for Public Affairs for the U.S. Department of Health and Human Services, said in a statement to NBC News that it would be a faster system. He said that the CDC has about a 1-week lag in reporting hospital data. The new, faster, and complete data system is what our nation needs to defeat the coronavirus and the CDC. An operating division of HHS will certainly participate in the streamlined all-of-government response, Caputo said. They will simply no longer control it, he said. The Times reported that the HHS database that will receive new information is not, I repeat, not open to the public, which could affect researchers, modelers, and health officials who rely on CDC data to make projections and decisions. Caputo told the Times that the CDC would still make data public. In the statement to NBC News, he said the CDC's gathering once worked well, but was inadequate today. The president's coronavirus task force has urged improvements for months, but they just cannot keep up with this pandemic, Caputo claimed. Today, the CDC still provides data from only 85% of hospitals. The president's COVID response requires 100% to report. Critics have charged that President Donald Trump has sought to downplay the severity of the coronavirus pandemic and that he or members of his administration have encouraged states to reopen, though the virus remains a threat. 4 former CDC directors or acting directors wrote an op-ed that appeared in the Washington Post Tuesday titled, "We ran the CDC. No president ever politicized its science the way Trump has." Tom Frieden, Jeffrey Kaplan, David Satcher, and Richard Besser warned in the op-ed of political leaders and others attempting to undermine the Centers for Disease Control and Prevention. They wrote that the Trump administration has cast public doubt on CDC recommendations and highlighted comments regarding the reopening of schools. As of Tuesday, more than 3.4 million cases of the coronavirus illness, COVID-19, have been confirmed in the United States, with more than 137,000 deaths linked to the disease, according to NBC News count. The issue of opening public schools in the fall with cases on the rise in many states has been a source of controversy. In recent days, Trump and his administration have pressed for schools to fully reopen, with the president claiming that Democrats want schools to stay closed to hurt his re-election chances. In California, the state's 2 largest school districts, in Los Angeles and San Diego, announced Monday that classes will be online only at the start of the school year, citing skyrocketing infection rates of the coronavirus in their areas. That's the end of the article. I think the article says all you need to know.
John, do I really need to ask you, what do you think that the information is not available to the general public?
I'm pretty sure you know what I think about that.
Not only do I know, but I agree with your opinion 100%.
Okay, good.
Yeah, let's have some transparency, man. Mike, you've got the next news story.
Okay, I'd just like to say that I certainly don't trust the Trump administration to be the gatekeeper of information on COVID-19.
I don't trust the Trump information as the Trump administration as the gatekeeper on any information. Go ahead, Mike.
Okay, well, especially life and death stuff. But California communities are scrambling to track down people exposed to the coronavirus after the state let many accelerate reopening without meeting minimum standards for contact tracers, a review of county data shows. The state initially told counties they must have at least 15 contact tracers for every 100,000 people before they could speed up their economic reopening. Of the 55 counties that attested they could safely reopen, at least 17 wrote that they did not meet that contact tracing threshold when they submitted their attestation forms to the state, although many outlined plans to expand their staff.
We've talked about contact tracing on this show many times. John, is it a HIPAA violation? Yes or no, and why?
I don't know, because I really never paid much attention to HIPAA. So I doubt it, though. I doubt if it is.
Really?
Because it's just talking about whether you come in contact with. So it's not asking you to reveal any of your.
Well, I don't, John, I don't know. I have not interviewed anybody who's been involved with contact tracing, be it as a patient or one of the alleged 20,000 employees of the state or the government or whatever. I really don't know what is required and what is allowed and what is not with contact tracing. Do you have any idea?
I don't think your medical history plays any role. Contact tracing is simply that, to determine whether or not you come in contact with anybody who has the coronavirus.
Mike Zyma, when it comes to contact tracing, is it a simple check the box, yes or no, you have or have not come into contact with anybody? Or does it also ask for current symptoms that you have had, current symptoms that the other person has had, where they have been? Are we dealing with a slippery slope, Dr. Mike Zyma?
Well, I'm not sure exactly what the protocol is for contact tracing, but I'm pretty sure that in the HIPAA statutes, there's nothing with regard to contact tracing. This is all new stuff for everybody. And I think that if the issue were to be litigated, hopefully quickly, if it has to be, there'll be an exception to the HIPAA requirements when it comes to contact tracing.
So if someone comes knocking, if someone comes knocking on my door, or I get a phone call or an email or a text message that says I'm an employee of the state of California or the federal government of the United States, and we have information that we believe to be true, that you, Steve Appell, came in contact with someone who has documented COVID-19. Is it true that you met them? Where did you meet them? When did you meet them? What type of symptoms do you have? I can simply say, F you.
I'm not sure, but I can imagine you saying that.
All right. Tell you what, Mike or John, whoever wants it, you've got the next news story.
John, why don't you go for it?
Okay. Church leaders question Newsom's order. As California Governor Gavin Newsom once again bars houses of worship in much of the state from conducting indoor religious services, some Christian leaders are critical of the governor's decision. The order restricting indoor worship services applies to any county on the state's COVID-19 monitoring list. On Monday, Newsom said that encompasses 80% of Californians. Jonathan Keller, president of the conservative California Family Council, said Newsom's order shows that the governor, quote, trusts big box stores like Costco and Target more than churches and synagogues, close quote. The quote goes on, though. Coupled with last week's ban on singing during worship services, people of faith are increasingly alarmed by Sacramento's disregard of their constitutional rights. We have to ask ourselves, where do we draw the line? Keller said in a statement. In Lodi, Pastor John Duncan of the Cross Culture Christian Center, which had defied Newsom's previous order and continued to hold indoor services, said that the latest order conflicts with the First Amendment right to peaceably assemble and practice religion. We believe it's God-given, as did the Founding Fathers, Duncan said. Editorial comment here. Obviously, he doesn't know anything about the Founding Fathers. Duncan said the church provides a necessary outlet for people who are feeling hopeless or depressed. More editorial comment. Obviously, he's never heard of psychiatrists. People do need church.
Well, thank you very much for that. Mike, do you have any closing thoughts or burning desires? Because unfortunately, it's come time to end the show.
Really?
No, thank you.
John Scalia, do you have any burning thoughts or closing desires?
Well, as I've said often enough, if anybody would bother to read about the Founding Fathers, they did not go to church. They believed in a God. They did not believe in organized religion in England.
The Founding Fathers did not go to church. John, you want to stand on that?
Well, they didn't. They believed in, they were deists, and if they went to church, it wasn't because they believed.
So the Founding Fathers did go to church.
They may have, but they weren't. They were deists. They were not members. Thomas Jefferson introduced a bill in the Virginia legislature when America was still a colony, so that the Church of England, which is now the Episcopal Church in America, would no longer be the state church of Virginia. What does that tell you? I mean, these guys came from the French Enlightenment.
And George Washington could not tell a lie and chop down the cherry tree. What does that tell you?
It tells you he has a sense of ethics, not religion.
Sounds to me like history may or may not be 100% accurate. And that's why we do what we do, okay, here at Work Comp Matters. I want to thank all of you for listening very much. It's been a hell of a show. Madman across the water, John Scalia, Chief of Staff, Dr. Mike Zyma, Scott Walton, legendary Uncle Studios, as well as A1 Law, and all the good people back at the Work Comp Central. My name is Steve Appell. We'll see you again tomorrow at noon for another edition of Work Comp Matters.